Namaste. Greetings from all of us at Apollo Hospitals and welcome to our Corporate Health series. This is Dr. Srinidhi Chidambaram here, and I hope you're all staying well and keeping great health. Our aim in presenting this series is to bring you awareness of health and well-being so that you can be successful, productive, and I do hope that you are regularly following all our sessions and finding them useful. Your heart health is central to overall good health. Your heart is responsible for pumping nutrient-rich blood throughout your body. It supplies oxygen while removing toxins and waste. As the center of your cardiovascular system, it is vitally responsible for just about everything that your body does. And it's very important to ensure that your heart is healthy. That will overall reflect on your overall health, and the way to do it is by embracing a healthy lifestyle at any age. You're never too old or too young to begin taking care of your heart. But how much do you really know about your heart health? It's very easy to be misled or fooled by misconceptions and myths. After all, you may think that heart disease is something that only happens to your elderly relative or somebody who eats only unhealthy food. Doesn't happen to everybody. There are many myths floating around, and relying on false assumptions can be very, very dangerous, especially when it comes to heart health. Cardiovascular disease kills more adults than any other disease in the world, but we are here to help you to separate fact from fiction. So let's set the record straight today on some common myths surrounding heart health to guide us and to give us an overview on some common myths and what the true facts are. I'm delighted and honored to welcome Dr. Rahul Gupta, Senior Consultant Cardiologist at Apollo Hospitals, Navi, Mumbai. Dr. Gupta holds more than 15 years of experience in the field of cardiac sciences and has been credited for performing various procedures as a pioneering effort for the first time. His area of special interest includes handling complex cardiac cases using advanced technology in the field of cardiology. He's already been associated with many leading hospitals in Mumbai. He's proficient in handling several complex procedures like angioplasty during a heart attack, using several latest methodologies in angioplasties, pacemaker implantation, cardiac synchronization therapy, and many more. He's also one of the few professionals in India trained in transcatheter aortic valve implantation and received his training under Dr. Alain Cribier in France and Dr. Geza Fontos in Budapest in Hungary. And he has many firsts to his credit, like first to perform the leadless pacemaker implantation, the first to perform bioabsorbable stent implantation, first to put stent using ESMR, and also holds several awards and accolades in his years as a doctor, including the Healthcare Excellence Award for the Best Cardiologist in his region, first in DM Cardiology, Shankar-Dayal Sharma Gold Medal, and many more, and also holds several publications and research listed under his name. Thank you, Dr. Gupta, for joining us today.
Thank you for having me here.
And we've actually been collating some of the commonly held beliefs that people have about cardiovascular and heart health. So in today's session, what I plan to do is to list them out one by one for you.
Yeah, sure.
And I think you'll be able to give us the correct perspective about these aspects of heart health. So let me just start with the first one. So I'm too young to worry about heart disease.
Yeah, so this is one of the very common myths. People think heart disease is only with older people, but that's not true. So we are seeing patients who are 21 years old, in their 20s, in their 30s, who are suffering heart attack. In fact, the majority of the patients who are getting admitted in the hospitals are actually young. So it is now a it's a complete myth, which you have rightly pointed out, that if you're young, you cannot have a heart disease. Everybody needs to take care of their heart health. In fact, what we are seeing today, the risk factors for the heart disease have started occurring at very early age. So we are seeing a lot of school-going children who are having, high blood pressure and cholesterol. So as we go ahead in the discussion, we will talk about that. But it's a completely myth that I'm too young to have a heart disease. You have to be careful from the time you have awareness that heart disease is common and needs, with certain actions and preventions, you can actually get it down.
Right. Next one is heart disease runs in my family, so there's nothing I can do to prevent it.
So I would begin by saying that, if a gun is loaded, it is only until unless you press the trigger, it's not going to fire. So when you have a strong family history, it means it's a loaded gun. But the trigger is with you, and the trigger is your environment. Trigger is the daily life which you are leading. So even if there is a strong family history, it's a loaded gun. But if you don't pull the trigger by a bad lifestyle, you won't manifest the heart attack or the heart diseases. So you have to take a little more care so that this loaded gun doesn't fire. That's it. But you need to take care.
So what do you think should be your, because most of our audience in this program are also working professionals and who are probably younger age groups, people with a family history. So what would you recommend they do to take care of their heart?
So, it's basically heart disease is a grave disease. But the good point is that small, daily, consistent actions can actually make the entire difference. So when I talk about the heart health, how to make yourself heart attack proof, I always tell people that they have to follow the 6 E, which are extremely important. The first E is their exercise. They should exercise daily. And the exercise can be of, cardiovascular type, which involves increasing your heartbeat, like running, cycling, walking, swimming, anything which increases the heartbeat, at least 30 minutes every day for 5 days a week. Twice a week, we should do toning, like muscle strengthening exercises. You don't need to go to the gym. You can actually use your own body weight and just tone up your big muscles, the chest, back, your thighs, which has to be done only twice a week. And then every day you can actually do stretching. You can do stretching even during your working hours, where you move, twist and turn your joints, you move all the joints so that they become more flexible, and circulation is also improved. The second is about the eating habits. You have to eat healthy, you have to eat peacefully, and you have to eat timely. The third E is your emotional health, which we might discuss. And the emotional health can be seen what is your happiness index? Whether you are happy most of the time, upset most of the time, how is your overall feeling? So you can improve your happiness index or happiness or emotional health. You can take care by meditation, by pranayam, by deep breathing, by reading positive affirmations. The fourth is about exiting your addictions, and tobacco, alcohol, excess alcohol especially, smoking, all these are harmful for your health and you should exit from these addictions. The fifth is enough good quality sleep. And enough means 6 to 8 hours. Most of the people will require. Good quality means that when you wake up, you are full of energy rather than drowsy and dull throughout the day. And the sixth is, which is extremely important and neglected, is evaluating your risk factors or evaluating your numbers on regular basis through health checkups, because they creep in like a silent killers and you never know that you have them. So your blood pressure number, your cholesterol numbers, your waist, hip ratios, your weight numbers, all those numbers are very important to be determined. So if somebody follows these, I think they can live a very healthy lifestyle and they can prevent heart attacks.
Absolutely. The next statement is cardiovascular disease is only a problem in the wealthy westernized countries.
So I'll give you an example. I was once visiting a nursing home where they requested me to see 2 patients, young patient of a heart attack. And they were on the same ICU. And one was a rickshaw driver who was, you can consider, from a lower socioeconomic strata. And he had the similar kind of heart attack, interval MI, around in his maybe late 20s and around 30s. And exactly same kind of profile. in a rich, so-called wealthy guy also suffered a heart attack. So it's completely myth that only wealthy people those who are sedentary and, poor lifestyle, they're eating a lot of fatty foods and all those things. Now it is nothing like that. That was the perceived notion, but it's all myth. Anybody can develop a heart attack, whether you are from any strata, if you don't follow what we discussed about the 6E in the previous question. So if you're not following a healthy lifestyle, whatever your economic status may be, you can develop a heart disease.
I'm a woman, I won't get a heart attack.
Yeah, so I would say that women, they behave differently. Their symptoms are a little different. So in a typical heart disease patients, you get chest discomfort, choking, pain radiating to the left arm, and these symptoms are pretty common in a male. In female, they present very atypically, and sometimes they are often neglected as acidity gas or atypical chest pain, atypical symptoms where they are just feeling fatigue, tired, nausea, different symptoms which are little not from the usual which people know of a heart attack thing. Women have been little safer because of their hormonal profile before menopause, but they actually pick up very fast after their menopause. This is one thing. So they catch up with whatever protection they had if they don't follow a healthy lifestyle. Second part is the women also today are working under stress. They're taking, basically they have additional stress. They are taking care of the family. They are at workplace. And in addition, women, lot of places, they have taken up, addictions which they never used to traditionally have, like smoking and tobacco products and all these things, alcohol in excess, which was not there. So we are seeing a trend where even the younger females are also presenting with heart disease, which was quite uncommon, say, a few years back.
Right. I'm thin, heart disease only happens to obese people.
Again, this is a myth. Even if you are thin, you have only one, say, obesity is one of the risk factors for heart disease and other disease. But there are multiple risk factors. There is a famous Czech proverb which says, misfortunes enter by a door which has been left open, or misfortunes enter by a window which has been left open. So there are multiple windows through which the heart disease can creep in. It's not only your weight which decides. So therefore, even if you are thin, you need to check yourself on a regular basis to find out whether you have any risk factors within you, which can be tackled early, so that you don't develop heart disease and don't develop a heart attack in future.
So here, I think there is also the recent phenomenon where we see that a lot of people say that, we have read about people having heart attacks after working out at the gym. Now, this is not a reason for people not to visit the gym, but what exactly happens to these fairly fit individuals? What are they doing wrong?
Right. So I would say here is the importance of, preventive checkups, because there are a lot of things, the heart disease or the blockages, they do not produce symptoms until as they have become severe. So when I say severe, more than 70-80%, then only the person would start experiencing the symptom of chest discomfort, breathlessness, heaviness or choking or pain radiating to the arms. These will come in patients who are having severe blockages. But a lot of heart attacks happen when the blockages are, say, around 50%. So they are not going to produce the symptoms, typical symptoms of the angina and heart disease as we know of. But these plaque can get ruptured while you are exercising in an incorrect way. These plaques, when they rupture or they develop a crack, what is the typical thing when you develop a crack on the hand is the blood oozes out and forms the clot. That's the mechanism which happens during the heart attack, that these blocks, they develop a crack, the blood oozes out, forms the clot, and it completely clogs the artery, and that is why a person develops a heart attack. So whenever somebody is starting with an exercise program, they have to always go slow and steady. You cannot be seeing your friend taking up heavy weight, which he has been doing since long, and you're trying to compete with other people. Your competition should only be with yourself, not with anybody else in the gym. Howsoever, whether they are senior to you in your age, whether they are, younger to you in your age, but you cannot be competing. You have to always begin with a warm-up period. You plateau your exercise and then have a proper cool-down period. If you manage all these things, actually, The chances of developing a heart attack reduces. Your overall cardiovascular risk profile becomes better. So you should always exercise, as we discussed earlier, also in the earlier question. But there's a way to exercise. You cannot be motivated today after this seminar, start exercising, and then land up in some kind of problem. So go slow and steady, and then you won't have any issues. If there are symptoms, you should take immediate action. Don't disregard it as an acidity or a gas or muscular problem. If you feel that there's something which is different, you should always seek a medical help. That's what I would say.
I've had a health checkup. My cholesterol, my TMT and echo are fine. So I will never get heart disease.
Correct. This is a very common question which people ask, that since my echo TMT is normal, and there are some people who say, oh, now I can eat anything, I can do anything, my heart is completely all right. I want to tell it to people that echo and TMT will become abnormal only when the disease has reached to a severe stage. As we were discussing, those people who do gym, who do marathons, and suddenly they develop a heart attack, these are the people who don't have severe blockages. So their echos, TMTs, and ECG will come out to be normal. It just means that you don't have a severe disease. And sometimes these tests cannot diagnose these, even some in few percentage of cases, severe blockages. So when these reports which you have said, ECG, echo, TMT is normal, it means that the possibility of a severe problem is very less likely, but still you need to take care of your health on regular basis, because even if the blockages, say they were 50% when you did a TMT, it will come out to be okay. But in a year's time, if it progresses to more than 70%, if you don't take care of your heart health, then they can produce symptom and cause heart attack. So you still need to continue to take care of your health in a good way, so that you don't land up with a problem. Here I would emphasize the importance of certain health checkups, which not only pick up disease only at the later stage, but some health checkups, they are they are not only they are actually going into a much earlier stage, which we call as primordial prevention or the probe prevention. And these are the patients can be detected by certain tests which can diagnose it much early, like calcium CT scoring, carotid intimal media thickness, and various risk scoring systems which are there, which can predict the chances of a heart disease. And you can start taking care even before you have any of these tests coming out to be abnormal. Just to mention, there is a program, because I work in Apollo, so I know there's a Apollo Pro Health program, which is exactly what I'm trying to discuss and tell you, that, it looks not only into the advanced tests which will pick up disease in advanced stage, but it will pick up disease at much earlier stage, even 10 years before somebody would develop a heart disease or heart attack later on. So we should emphasize into going into that kind of primordial prevention, where we are able to detect, pick up, and pick up those people who are at risk of heart disease in, say, 10 years from now. I think this is a wonderful question, and people should go into those kind of tests where we are able to detect much early before they actually develop the heart disease.
And I think what is important is, if you look at health check programs, there are different types of programs available everywhere. But I think a lot of people think that you just have these discrete tests. You have one ECG, you have a blood test, you have these 20 lab tests. It doesn't really like lead into anything. You just keep doing it. I think what is more important is to assess your risk and prescribe a personalized kind of, or try to detect it much earlier than, not at the latest. And I think I'm glad that, in our Pro Health program, we have the AI cardiac risk prediction. And I think there's an algorithm where I think even if your TMT is normal, if there are certain other factors, they do ask you to do a CT angio, and then they look at your calcium score. So I think it's important for people to choose the right screening as well. So going on to next, I think coming to some of the risk factors, people think that, it's okay when your blood pressure goes up as you get older. So that's...
even if you are getting older. So there is some relaxation for people who are very elderly, because if you try to reduce their blood pressure vigorously, they have a tendency to fall because there can be little fluctuations. But even if you are getting older, your blood pressure target has to be managed. If you want to live a longer and a healthier life, it is important that you still try to get your blood pressure under control. So typically till the age of 65, we say try to keep it less than 130/80. Even more than that, if you can manage your blood pressure less than 130/80, either through diet, lifestyle, exercise, or medications combined, it is good. But as you grow older, say you are 75, you are 80, 85, and there can be a variation where the upper blood pressure go high. So it can, the upper blood pressure, systolic blood pressure can be like 180 and all, and the lower blood pressure can be like 60 and all. So we accept those kind of blood pressure. So there is little relaxation as we go up in the age, but this has to be decided by the doctor based on looking at all the different parameters which we look during the health checkups of our patients who are elderly, and then we decide what is the appropriate blood pressure for this patient. But it's not a relaxation. You should maintain your blood pressure at whatever age you are in, below the target level which has been suggested at your according based on the doctor and your overall profile.
I'll know if I have high blood pressure because there will be warning signs.
So a big myth, people in fact come to me and they say, sir, my blood pressure has been high. I come to know when my blood pressures are high. Otherwise, if I left my medication because I was feeling completely all right, it's a complete myth. Majority of the high blood pressure patients, they do not have symptoms, and therefore it has been called as the silent killer. So even if you don't have the symptoms, your body is getting damaged because of the continuous high pressure which is present in your body. So there is a wear and tear which is already happening. We cannot be waiting for the complications to occur when they will produce the symptoms. So it's a complete myth. You need to check your blood pressure, once in a while. The best time to check the blood pressure is either before breakfast in the morning in a comfortable sitting position with your back and hand rested and legs rested, and once before dinner for those people who want to check their blood pressure. Those who are on medications, they should check a little more frequently. When they are introduced with newer medications for the first time, they have to check it almost daily. But it has to be checked. You cannot decide your blood pressure, the medications based on your symptoms alone. And majority of the patients do not have these symptoms. So if you have been diagnosed with blood pressure, don't neglect it. Check it. Then only discuss with your doctor and decide about the strategy of reducing or increasing the medications.
The next myth is really about statins, because there are two things here. One is statins are harmful. They have a lot of side effects. So I'll just manage my cholesterol with exercise and diet. The second one is if I take statins, then I can eat whatever I want.
Yeah. So I think these are, you've collected the most common myths which we also come across whenever somebody have these questions, whenever we start on statins, because there are so many articles and we know the internet is full of information. But I always tell that you can get the information, but information doesn't mean knowledge. Application of the information in the correct way for the correct patient, correct scenario, correct situation is the knowledge. And therefore, all these myths arise from the information or misinformation which is present. Statins have been proven time and again as one of the best medications to control the cholesterol levels and prevent the occurrence of heart disease. In fact, all the patients who develop a heart attack, their chances of repeat heart attack is very high, and statin is one of the important molecule to reduce it. The side effects related to statins are so minuscule and they are so uncommon, the major side effects, that literally everybody who needs it can take the statin without the fear. There are certain common symptoms which whenever you experience, you can go and discuss with your doctor, and he will be happy to change your medications or reduce the dose of medications. And then there are other medications also to reduce the cholesterol. But statins are useful. One thing, it has been proven time and again through different landmark trials, and the side effects related to statins are minimal. the side effect of not controlling the cholesterol are much, much higher. Developing heart attack, developing stroke, developing blockages in the leg arteries and causing peripheral vascular disease are much, much higher, I would say, than the minuscule side effect of the cholesterol, the statins, which is a cholesterol reducing medication. But just to tell you, diet contributes only to 35% of the total cholesterol value which we have. So people who have got high cholesterol, they can control to a little extent with diet and exercise, but not completely. And you should always give a trial of diet and exercise in each and every patient when they come to us, so that we can see for next 3 months, 6 months. And if it is not getting controlled, one should not shy away from taking the statin, because this is a molecule which has been proven time and again through landmark trials, through lakhs of patients who have been studied in a controlled surrounding as to the benefits of it. And it has proven that it reduces the incidence of heart disease, it decreases the risk of stroke, and all wherever the cholesterol deposits and forms the blocks. So all that can be controlled. Those patients who have developed a heart attack and they want to prevent recurrence of heart attack, again, statins plays an important role. The side effects related to statins are so minuscule, and the major side effects are almost very rare. They can happen, but when I say, what would you like to accept? The side effect of having a high cholesterol, which is very high because you can develop so many diseases of uncontrolled cholesterol, or the side effect of statins, which are treatable, which are rare, which are less, and serious side effects are extremely rare. So one should not shy away. And the second thing is, people say that if I am having statins, so then I can have whatever food I want. Statins will control only the lipid part, the cholesterol part of it. But then there are high calorie intake related part, there is high sugar related part, and there are other free radicals or the toxins which are there in the food, which can in the junk food or the food which is unhealthy. So when you're taking statins, it is not allowed to be unhealthy and do a reckless lifestyle that I'm being protected. It will not protect you completely, although it is one of the important component of prevent in the heart health treatment in those people who deserve it and those who fall into the criteria of having it. So don't shy away from taking the statin if it is needed. Of course, diet and exercise is our primary way of treating first. And once you are on statin, don't indulge into unhealthy lifestyle. That's my very strong message.
So talking of diabetes, another belief is that, as long as my sugars are under control, or even as long as I take my diabetic medication, I will not, nothing will happen to my heart. So where does this line, where does it come in? Is sugar control all that is required for diabetes not to affect the heart? Or
yes. Correct. So again, this sentence which has emerged from, there are a lot of people which I see in our day-to-day practice who are on medications. They are taking in the medication of diabetes, thinking that everything is now all right and, I can't develop a heart disease or everything is okay. But more important is not only about taking the medications, but the correct amount of medications. When I say a correct amount of medication means it keeps your sugar under the target level. So we again have a target level for the fasting blood sugar, post-lunch blood sugar. It is not enough to take your medications on regular basis. It is also important to check your sugars on regular intervals, even if you don't have any symptoms, because again, high sugars or diabetes is asymptomatic disease. It doesn't produce symptoms of its own. The symptoms which come are of the complications. So we can't wait for the complications. Diabetes can affect heart in multiple ways. It can cause weakness in the heart muscles. It can cause increased chances of blockages in the heart vessels as well as the other vessels of the heart, increasing the risk of stroke and kidney disease. So diabetes has to be controlled, and then associated risk factors also. So it's always trying to control multiple risk factors, not only one. As I told you in the initial answers, that misfortune can enter by any window which has been left open. These windows are very easily closable, and you can actually prevent them, the risk factor preventing them to enter in your body. So it's important to take care of your sugars. Regular checkup is again important in this scenario. and knowing that your sugar values and sugar numbers are under control. The sixth E, which I spoke about, that evaluating your numbers on regular basis to find out that you are on the right track. Your track is not getting deviated.
Here's another famous myth. Smoking is something that affects my lungs and not my heart.
That hundreds of them are actually very toxic. Not only the nicotine part which causes the addiction, but then there are other components in it which are very toxic. It can impact lungs as we are inhaling it, but it can also impact all the arteries in the body because it hardens the artery. It increases the chances of plaque rupture. It increases the chances of acceleration of the block building mechanism, the plaque building or the block which is getting built up in the arteries. It gets accelerated with the smoking and tobacco products. So smoking not only impacts the lungs, it equally impacts the heart. It also increases the chances of multiple cancers, including bladder and pancreas and a few other cancers. So it's not a benign thing. It's not only impacting the lungs, but multiple other organs, including the heart, which is one of the most important things.
So I think the maximum number of myths, I think, are only around heart disease. So there are a lot of them, but we may be running short of time. But I think we'll move on to a few about actual symptoms of heart attack and recognizing them because that's important as well. So this one myth is that, I know when I'm having a heart attack, which means that I'll have chest pain and sweating. So you already said that there are some people who don't. But is this always present in men, for example?
Right. So typical symptoms, we all know somebody getting a squeezing pain, choking sensation, cold sweats, breathlessness, palpitations. All these symptoms can be manifestation of a heart attack or a little bit of alarm that suddenly squeezing is coming in and going out. But I always tell, or some people, they feel acidity and gases in their abdomen, in the chest, and they feel that it is just an acidity. We should be aware of the fact that if you feel that something is unusual from nose to your navel, if you draw a square or a rectangle, whatever you want to say, anything which comes in this structure can actually get discomfort in a heart attack patient. So there can be pain in the back, pain in the jaw or the neck, pain in the arms, pain in the upper part of the abdomen, pain in the lower or upper part of the back. All these areas can have symptoms related to heart disease. Only thing which you have to take is, this may be a false alarm, but I urge everybody that whenever you develop any unusual symptoms, just get your ECG done, just get your first evaluation done. It may be a false alarm, but it's absolutely okay. But rather than waiting at home, letting it build up into a major heart attack, causing a lot of complications, even resulting in death. So therefore, preemptive and quick actions are important when you feel something is unusual. Fatigue, tiredness, initial symptoms could be when they walk, they are feeling too tired these days, or choking in the sensation which comes on exertion. These may be the pre-warning before the heart attack. So these are some of the ways the heart attack can present.
I have pain in my legs, which I'm sure has nothing to do with the heart.
Right. So again, as I was discussing in few other questions, that the plaque buildup or the cholesterol plaque or the calcium or fibrotic plaque which builds up in any of the vessels will start causing discomfort. So the leg pain which comes on walking and all could be the early manifestation of severe blockages in the leg artery. So this is called as a peripheral vascular disease. So periphery means anything away from the heart. These are all peripheral vessels. The central vessels are your heart vessels and the one which are supplying the just the upper part, the arch of the aorta, from where the most of the vessels originate, the beginning. So these are peripheral vascular disease, and they may reflect that there are already plaque buildup and blockage in the leg arteries. And those who have already developed the blockage in the leg arteries, there is a high chances that they might be having the blockages in the other parts of the body, including the heart. So they have to be careful. They have to get evaluated if they feel discomfort or pain in the legs or walking, with a very simple test which can be done by a USG machine to find out whether there are any blockages in the leg arteries.
This one was quite a famous myth that was circulating on social media. about people having a heart attack and then coughing vigorously could actually help them save their lives. So I think this is, I don't know if it still persists, but this was circulating quite frequently a bit a while ago.
I can't tell you. I also read it being discussed and all those things.
Cough CPR or something like that.
Yeah, cough CPR. So I really don't know, but it has been described in the literature that, the most of the time when somebody has a heart attack, the reason for them go into a cardiac arrest is the heart starts beating very fast. And because the heart is beating very fast, it is called as ventricular tachycardia. Ventricle is the lower chamber of the heart, which can eventually lead into the cardiac arrest. But I think somebody who is sinking, it is practically impossible to carry out those maneuvers. I always suggest people that whenever you are feeling uncomfortable, call for help. Even if it is a stranger, if you are driving, if you're walking, just call for help that I am feeling uncomfortable. This is my number, this is what thing. Can you call somebody? Just put me in and take me to the hospital or call one of these relatives. I also urge people that people should learn CPR, because if you learn CPR, you can save lives. There's nothing better achievement or success in life if you can save even a single life, because that single life may be a father, son, husband, or whatever the relationship, because you can save that life. So that's what you should do. Reach for medical help before it becomes too severe. And you can try these maneuvers. I am not sure whether they are going to help, but there is no harm also in doing those. But I think you should just reach for medical help.
I think if it's a time-wasting effort, I think it's better that reaching the hospital might be better.
Yes, yes.
I think I'll just have one more, which I think is not really a myth, but I think this is a couple of terms that people get a bit confused about. So one is heart failure, then there is heart attack, and then there is cardiac arrest. So these are not the same, but people often. So I think if we can.
Yeah. So I'll tell you in a very short. When heart has two functions, it contracts and pumps the blood into the entire body. It relaxes and it accumulates all the blood from the lungs, and then again it pumps. So when the heart fails to perform these functions, it is called as a heart failure. It doesn't mean the heart has stopped or patient has developed a heart attack. There can be multiple reasons why this happens. Heart can become weak because of the heart attack, and it can become weak because of the other reasons also. So heart failing to perform its normal contraction and relaxation, which results in fluid accumulation in the body, causing swelling over the feet, causing breathlessness on lying down. All those are heart failure symptoms. The second is heart attack. So heart attack is a situation where there is a clot formation in the heart artery, as I discussed earlier, and it impedes the blood flow. So one part of the heart has stopped functioning because there is no blood supply in one of the arteries, which has now led to the heart attack. So heart attack, if untreated, can lead to heart failure. Then third is the cardiac arrest. Now cardiac arrest can happen because of heart-related problems and non-heart related problems, where the heart actually stands still. So it goes into the arrest, means it's now no more contracting, and it's not able to perform its function at all, and it completely stands still. So therefore we have to give CPR when somebody has developed a cardiac arrest, because the heart is in an arrested stage, so it's not able to function. It has been arrested. So you need to give CPR. You need to give a shock if there is a electrical ventricular fibrillation where the heart is beating at 300 beats per minute, which is like effectively no contraction. So arrest means heart stops completely. Attack means one of the arteries had got choked in. So the heart, those symptoms come in, and the patient, one of the area of the heart is not functioning, and heart failure is heart is not able to either contract or relax properly.
Is there anything else that you would like to convey to our audience?
The only thing which I would say, we celebrate World Heart Day on 29th September every year. That heart is a very important organ of the body. It's the master organ, because it's supplying the entire other organs and entire body to keep it functioning. Taking care of heart is not very difficult. It is only small, consistent, everyday action that can make your heart attack proof, and you can live a very healthy life without heart disease. It's very simple. It's not difficult at all. Evaluating your risk factors in the present era is an extremely important. You should take care, even if you're not having any symptoms. It is absolutely important that every year we go and check ourselves thoroughly related to heart and every other organ, so that we can pick up things much early and take corrective actions so that we don't develop that heart disease. Thank you very much. This is my message to every listener.
Thank you so much, Dr. Rahul Gupta. So viewers, false or misleading health information is something that is very dangerous because it impacts your health. It can affect the relationship between the doctor and patient. It can stop you from pursuing healthy behaviors, or it can discourage adherence to the proper evidence-based treatment or the proper lifestyle advice. At Apollo Hospitals, we are committed to empowering our community with the right, clear, concise, and reliable evidence-based knowledge about health. And I hope that this session did help you to clear those misconceptions so that you can make informed choices about your heart health. This World Heart Day, we are happy to continue our mission with educating people about the dangers of heart disease, promoting healthy living habits that can prevent heart issues, encouraging people to take charge of their heart health as well as their overall health by adopting healthy lifestyle, avoiding tobacco use, engaging in physical activity, following a balanced diet, managing stress and sleep. But above all, getting your heart risk checked annually, get your heart health screened annually. And we are here to help you to keep your heart in fine shape. We have our specially curated Pro Health checks, AI-based cardiac risk factor predictions. We have the health mentoring to follow up on your lifestyle. And of course, we have the world-class facilities to treat your heart conditions and get you back to great heart health in no time at all. So do reach out to us. Till we meet again, thank you and namaste.